Morning to all of you. Yesterday, I have explained about exempted services under the heads of medical and healthcare services and social care services under GST scenario. In continuation of such video, today I have completed that video. Yesterday, we have discussed about the exemption services under GST scenario of medical, healthcare, and social care services. But in medical, healthcare and social services, there are three types of services are taxable under GST. Friends, this is most important. Up to yesterday, in yesterday's video, we have discussed about the exemption services of the medical healthcare services and social care services. Now, today's I have explained to you what are the services are taxable under the GST scenario on services provided by the service provider to the service recipient in through medical and healthcare and social care services. Friends, there are three types of services are taxed under GST scenario of medical and healthcare services. First one is obesity services. Second one is hair transplantation. Third one is plastic surgery, cosmetic surgery or plastic surgery. So, who are providing the services to the patient to treat, to start the treatment on to reduce the obesity. For that, he has charged some charges and joined in the hospital. During the treatment of to reduce the obesity, they have provided accommodation, food, medicines, and other charges, medicine charges. So for the charges, the hospital management has collected or doctor has collected some specified fees for particular services. Who are providing that services? They have charged GST at the rate of 18% on all these services because it is a taxable service under GST scenario. Second is air transportation. Air transportation means who are want to remove the old air and install the some surgery hair, plastic surgery hairs to his head. That services who are providing the doctors or clinical establishment. For that, they have charged some charges for including accommodation, food and treatment and medical charges, including medicines. For that also, they have collected GST tax from the service recipient. Finally, plastic surgery. Friends, in plastic surgery, there are 10 types of plastic surgeries. Why I am telling you, as a tax practitioner, that is your responsibility to verify the tax invoices prepared by your client. Sometimes by overlook, instead of showing the taxable supply, your client has mentioned as an exempted supply, you have to identify which type of services done by your client. Sometimes, if out of these total 10 plastic surgery names are mentioned in the tax invoice, but you have mentioned as an exempted services or your client has mentioned by mistake mentioned as a exempt services to avoid the inconvenience and harassment from the department, your client is liable to pay appropriate tax on the appropriate plastic surgery. So before preparation of the books of accounts and returns, as a tax practitioner, you have feel the responsibility to verify the books of accounts and tax invoice and file the return. So my intention is you must know the subject more than your client. So my intention is today in detail I have to explain the taxable services under medical and healthcare services like plastic surgery. In plastic surgery, there are 10 type of plastic surgeries is there as per GST law, as per medical law, medical terminology. So first one is tummy tuck. Tummy tuck means who are having any surgical operation to remove excess flesh from the abdomen for cosmetic purpose. So that who are providing that services, that service provider is called hospitals or doctor. He has to charge something for providing the services to the recipient. So tummy tuck. So further, they have charged the GST tax. They have charged whatever charges charged by the service provider. They have charged along with the GST tax at the rate of 18% on the services. The second one is eyelid surgery. Eyelid surgery means sometimes reduce the bigness from lower eyelid and remove excess skin from the upper eyelid. This surgery is usually done for cosmetic reasons. So, who are providing the IELD surgery, that person is charged something for providing his services to the recipient. For that charges, he has to collect the GST at the rate of 18% and liable to pay to the government. Third one is breast augmentations. Breast augmentations means it is for women. So, who are doing the plastic surgery for breast surgeries are also taxable. So that service provider charge the services taxes services from that inpatient. He has to collect GST tax along with the 18% rate of tax and pay to the government. Fourth one is buttock accommodation and lift. Buttock augmentation and lift means either of the two round fleshy parts of the human body that form the bottom during the buttock lift. Excess skin or fat are removed from the buttocks. So, who are handling this treatment of services to the recipient? For that, he has to take the charges for the inpatient for medicines, accommodation, food, and for his treatment charges. For that, they have to charge GST at the rate of 18%. Next one is lip enhancement. Friends, generally human body, different type of persons are having. If any person having an problem with lip, for that he has approached the plastic surgery doctor. For that, the doctor is operated surgical improvement of lips. That cosmetic procedure can give your fuller. So, who are handling that services of lift enhancement, that charges also taxable under the GST at the rate of 18%. Reshaping of the nose. Friends, normally most of the persons are not interested to their nose originally shape of their nose. So they want to operate with the plastic surgery to their nose. For that they approach the plastic surgeon. That plastic surgeon operated the change of the shape of the nose. For the treatment, they have charged some fees for treatment, accommodation, food, and medicine. For that, they are liable to pay tax at the rate of 18%. So, service provider has to take fee along with the GST. Third one is reshaping. Seven one is reshaping of the ear. Most often done by the pinning of the ear closer or to head. Sometimes some of the persons are not having a proper look for their ears. Further, they want to take plastic surgery to their ears. Further, they have approached the plastic surgeon. That surgeon has done some plastic surgery to that year. That charges is also taxable under GST at the rate of 18%. Eighth one is removal of wrinkles and sign off again from the face. Normally, any person want to do plastic surgery for his face, skin. They have approached the plastic surgeon. The plastic surgeon took the plastic surgeon to their face. That further, that surgeon is collected some amount along with he has liable to pay 18% GST tax on that. 9 one is neck lift. Neck lift also it is a cosmetic procedure that removes excess. So who are providing the services to neck lift? That surgeon plastic surgeon has collected surgery charges along with the medicine, accommodation, and food and everything. Further, he has to take GST tax also from the service recipient. Last one is cheek lift. Lift means tightening of the cheeks of any person. So who are handling the about 10 plastic surgeons to the patients. Further, they have to take surgery charges, accommodation charges, medicinal charges, and food allowances, and all these things they are liable to pay rate of 18%. Friends, regarding requirement of registration, who are providing the medical healthcare service and social care services. Friends, 80, before going to the taking the registration, you have to refer what is the main activities of your client. Whether your client is an hospital or a doctor, they are doing the services for exempted services as well as taxable services. That means if that such hospital and doctor doing the practice or doing the treatment of illness to any person with exempted supply or plastic surgery. For example, sometimes your client is doing a plastic surgery to the patient. That means your client is doing plastic surgery. That means taxable supply or exempt supply. Under that scenario, you have to for taking the registration section 22 or 24 whatever aggregate turnover, that means taxable and exempted turnover. If crossed 40 lakhs, they have to take registration. But liable to tax only to the extent of taxable services only. That means who are providing the services for medical health care services, who are handling the plastic surgery, obesity charges, or hair transplantation. These three services are taxable services. So, to that extent, they are liable to pay tax to the government. So, regarding input tax credit, if your client has to maintain the books of accounts relating to inputs, whatever inputs are used for the providing the services of air transportation, plastic surgery, obesity, for that inputs 100% they are eligible except accommodation. Accommodation, they are not liable to get any input tax credit because it is a building, any machinery or medicines or any inputs used for the treatment, for that is eligible to claim 100% tax, but separate, they have to maintain separate account only. If it is not possible to maintain a separate account, then proportionately you have to calculate to what extent out of total turnover of per month, to what extent they are using the inputs for the taxable supply and tax exempt supply. So you have to calculate the proportionately and eligible to claim input tax credit. Regarding the place of supply in medical and healthcare services and social care services. Friends, if service recipient, service provider both are residing in India, under that scenario, you have to refer section 12 place of supply. That means location where the services are actually performed. That means where the treatment has done to that patient, that place treated as a place of supply. For example, both are residing in outside India. Under that scenario, you have to refer section 13, subsection 3. And that scenario, location where the service is actually performed. That means rule 7 of the IGST rules, you have to refer rule 7. According to my knowledge, for that also, place of provision of the services is the criteria for place of supply. Friends, this is the my video regarding provision of services under the heads medical healthcare services and social care services. So you have to take care while filing the returns and verify the books of accounts and identify the SAC code properly, whether your client is mentioned or not, whether what are the vast type of service your friends your client has made or doing providing service to the inpatients. You have to verify thoroughly and prepare the books of accounts and prepare the returns and pay the tax to the government, appropriate tax to the government. So today I have completed medical and healthcare services. Friends, mostly today evening I have provided my notes in English version and Telugu version also. English version by 6 o'clock, Telugu version by 5 o'clock on MSME industries. Thank you very much. Kindly, friends, again I am requesting all of you kindly subscribe my YouTube channel for more videos. Thank you very much.